Okay, so this morning I wanted to do another Facebook Live. I haven't done one since I think over the weekend because there are a couple updates that I wanted us to look at, and there are a couple new pieces of information that I wanted to bring to the table. Of course, COVID-19 is an ever-evolving disease. It's a new disease, and every day we are learning a lot more. The world, and this is happening worldwide. I am eternally grateful that we have organizations throughout the world that have been looking at this, that have been using COVID-19 as an opportunity to expand their knowledge base and to do research continually, and that research is influencing the new guidelines that seem to be coming out all the time. A lot of the information remains the same, but with more evidence, we can now speak about things in a more definitive manner as it relates to COVID-19. So very quickly again, I wanted to let's ensure we are all using the right terms at the right time, because I think that is causing some of the confusion also. So the virus is called SARS-CoV-2, Severe Acute Respiratory Syndrome, SARS, Coronavirus, CoV-2, because this is the second version of it. It is part of the it is part of the grouping of coronaviruses that's been around forever. And this is why, for example, if you look at some of your cleaning materials and so forth, they do say that it kills coronavirus because the coronavirus has been around. That's a group of viruses that's been around for quite some time. This novel coronavirus, though, it's a new version of the coronavirus, and in February the WHO officially termed it SARS-CoV-2 because it is the second go around of the coronavirus that seems to be that is causing people to have a severe acute respiratory syndrome. So that's the name of the virus. The disease that you get as a result of being infected with SARS-CoV-2 is coronavirus disease 2019, short, abbreviated, well, not really abbreviated, but for short, it's known as COVID-19. So that's where COVID-19 comes from. I think you need to put up your volume very high, Karen, because the volume is pretty low right now. So you have to, I am kind of shouting loudly, others are hearing very well, so turn up your volume as high as possible. I wanted to also talk really quickly about, let me just do a check here, just to make sure. Right, so I am hearing it. Right. So I wanted to take a little bit of time to do a couple, to do some definitions, because particularly since the Ministry of Health and other places have been using these terms, it's important to know what these terms mean. And if you see me looking left and right, it's because I have notes on one end and I have my computer set up on the other end and I have my phone in my hand. So I am trying to navigate looking at all of these things to make sure that I'm giving the correct information. Okay, so let me start with the definitions really quickly, and I want to use the WHO's definitions because those are terms that come up continually, particularly when the Ministry of Health is speaking. They've been talking about differentiating between imported cases, local cases, and the term community spread has been used also. So according to the WHO, and this is a document that I will post, I guess I should have posted a link to it. I will post it. It says that, so there are three different terms that we want to differentiate: imported, local spread, and community spread. Imported cases means that the person who has COVID-19 has it because they flew from somewhere with it. So they already had it when they got onto the plane, got onto the boat, got onto however they traveled between that country to this country. They did not pick it up in Trinidad and Tobago. They picked it up in China, in the United States, in Jamaica, in wherever they were. That is where they picked up the case. Okay, so that is what imported means. Now, this is why the Ministry of Health has been talking about the fact that the 40-something that came off of the cruise ship, of course, those are imported cases because they got it on the cruise ship and they did not get it here in Trinidad and Tobago. There are a couple others who had travel history who got it wherever they came from. They did not get it in Trinidad and Tobago. So that's the imported case. Now, we have gotten to the point where the number of people who were on the ship and the number of people who get it from other areas, whether imported or not, has begun to level off, because we are now at 90-something cases, 40-something of those from the ship, 40-something of those, and every day it's going up. We will now soon have more people who've got it from other situations other than on that cruise ship. So it is beginning to be almost a mute case to discuss cruise ship versus non-cruise ship. And I'm raising that point because it means that the rest of us become more endangered when the non-cruise ship number starts going up and going up and going up, which it has. You then have what are known as local transmission cases. And what local transmission cases means is that it is a case that was acquired in the country. So it may have been a situation where someone came on a flight. So the person on the flight is an imported case, but because the person who came with it did not know, possibly did not quarantine themselves, was not properly isolated, they were able to infect other people, meaning it could be somebody at home, somebody that they interacted with in a grocery store, somebody else, and that other person has contracted the virus in Trinidad and Tobago. So that is a local transmission. That's a local transmission. Okay? You hear them talking about primary contacts, secondary contacts, tertiary contacts. That is also important because the person may be in a home and the people who they interact with in the home are considered primary contacts. The people who those people interact with outside of the home, secondary contacts. And then the people who those people interact with in the community, those are tertiary contacts. Okay? So you have the person who may have come from wherever they came from with it is inside the house. They have now infected somebody else in the house. That's a now local transmission to a primary contact. That local transmission, that person, so aunt or uncle or whatever, then goes outside to the grocery and they interact with other people out there and they now have infected somebody out there. So that's a secondary. And then, of course, we could see where it goes and goes and goes and goes. Okay? So that's critical. With local transmission, they use the term local transmission or local contact or local infections because we can still pinpoint where each person got their infection from. So even if we're talking about the person in the grocery, the person in the grocery could say, I got, or from contact tracing, I got my infection because I interacted with Miss Jean, for want of a better term. And Miss Jean can say, I got my infection because I interacted with my daughter who came from the United States. So we can identify exactly where each person got their infection from. If it is somebody coming from outside, it's imported. If it's happening within the borders of Trinidad and Tobago, it is local. Community spread happens though when we have people popping up in the system as being infected, but we can't pinpoint where they got that infection from. So that's where the community spread comes in. They are popping up as positive, but we don't know where they got the infection. Now, Trinidad and Tobago can safely say for the most part that we do not really have community spread, but it is actually not 100% true, because when you look at the criteria for testing that we've used for quite a long time, the criteria included the person must have flu-like symptoms and the person must have had contact, either had just come in, so they had a history of travel, or they must have had contact with somebody who had a confirmed case of COVID-19. That means they were already limiting the number of people who they tested, so they were not able, or they would not have been able to pick up if there was any real community spread, because those people who have community spread would not have qualified to be tested. So I want us to be very, very clear with that. So even though we keep claiming that we don't really have community spread, it is really, in my mind, a false sense of safety, because our testing criteria has not really been wide enough to allow us to identify if we really have community spread. So I wanted to ensure that we understood that part of it, because, and again, this is why it is so critical for us to think through this whole idea of social distancing and why staying at home is so important. Okay? So that's the first thing. I wanted to ensure that I made those definitions very, very clear. Okay? So how is this virus spread? This is a virus that all of the research so far indicates that the virus, which needs to survive for, okay, so let me go back a little bit. For a virus to survive, it needs to be inside of something. It needs to be inside of something that gives it nourishment, for want of a better term. And it needs to be inside of something that has a mechanism that allows the virus to replicate. A virus cannot replicate on its own without that external host that allows it the mechanism. The virus does not have what it takes inside of it to replicate all by itself. Okay? So if the virus is outside on its own, it will not replicate, and after a while, it will die. So that's the reality. The length of time that it takes to die is still relatively questionable. I am seeing, depending on the material that it is on, it may take a couple hours or it may take several days. There was a study that looked at the Diamond Princess cruise ship, which was one of the first cruise ships where they had large volumes of people on the cruise ship getting sick. They've looked at that cruise ship particularly, and they've identified virus that is still living up to 17 days after. So the amount of time that it takes for the virus to die while on its own outside of the host varies. Okay, so I wanted to make that part very clear. The virus moves from one person to another person by being encapsulated in what is known as droplets. Give me 1 second here. By what is known as droplets. What are droplets? Droplets are liquid bodily fluid that comes out of our mouth, out of our nose, and out of our eyes, depending on what's happening. So it's the bodily fluid that comes out of our mouth and our nose primarily. When the virus gets into our mouth, into our nose, and into our eyes, it has basically something on the outside of the virus that causes it to attach to our mucosal linings. So the linings of the mouth, the lining of the nose, and the lining of the eyes, those are mucosal linings. And there is something on the virus that attaches to the mucosal linings. Okay? So that is why they keep telling you, don't touch your face, because the virus may be on your hand, and then you take your hand and put it by your eye, put it by your nose, put it by your mouth. The virus then latches onto your mucosal lining, gets inside of you, and then starts multiplying, because it now has the mechanism. Our cells, because our cells multiply on their own and so forth, it now has the mechanism using our own cells and the multiplying mechanism of our cells to trick our cells into multiplying the virus. Okay? The mode of transmission, there are several, there is kind of conflicting, but it's not really conflicting, because if you've been listening to folks from day one, they've really been saying the same thing. In terms of the mode of transmission meaning droplet versus airborne and that kind of thing. So the virus gets inside of our droplets, and the droplets come from our mouth and our nose primarily, and passes when droplets move from someone who is infected to someone who is not infected. Okay, so the virus is inside the droplets, and the droplets move from someone who is infected to someone who is not infected. So that is why they say, if you are sick and you have symptoms and you are sneezing and coughing, for example, you are actively throwing droplets out of your mouth. I am sure we have all experienced it. You sneeze and you automatic response, put your hand by your mouth. You feel wet stuff on your hands. That is what we're talking about. That liquid on your hand, that is the droplet. Now, they've been able to differentiate because there are different sizes of droplets. We have pretty large droplets, which we still classify as droplets. But if the droplet is pretty small, then they can't consider it a droplet nuclei, meaning it's a very, very tiny droplet. This is where it's critical. If you have big droplets, which we feel when we sneeze and we cough, because those droplets are big and because they are heavy, they quickly fall to the floor. They quickly fall to the floor, or they fall on surfaces that are close to you. So if you are sitting next to a table, for example, and you sneeze and you have those big heavy droplets, they fall quickly onto the table, onto the floor. That is why individuals can then pass, if you have not sanitized your table, can then pass, touch the table, and then pick up the virus from the table onto your hands. And then you, because we are normal human beings who touch our faces, you then take your hand and you scratch your nose, you scratch your eyes, you thing your mouth. That's normal process, and that's why we've been telling people to be so very, very, very careful, because it is a normal thing for us to touch our face, but we just need to be way more conscious of it now so that we stop ourselves whenever we are about to do it. Okay? So those are for the large droplets. The large droplets. So this is important because remember, I am sure we've all experienced it where you are standing next to somebody who happened to have sneezed or coughed, and even if they did that, because you are so close to them, you still feel a little bit of the water. You still feel a little bit of that liquid, that ew that comes out when they sneeze or cough. That's one reason why we need to stay far from people, at least 6 feet, because we don't know when that person is going to sneeze or cough. We don't know. They don't know when they are going to sneeze or cough. Particularly if we have not been feeling sick, meaning we don't have signs and symptoms, then the sneeze or the cough would surprise you. So they may not have enough time to put their hands or put their elbow to block the sneeze or the cough. Now that is important as it relates to social distancing, because when you are out there, if you are one of those people who need to go to the bank, need to go to the grocery, need to do whatever you are doing outside of your house, you may be walking by someone who happened to just sneeze, and they did not have enough time or have a good enough reflex to block it. And even though you have been trying your utmost best to stay 6 feet away from anyone, you just happen to have to cross in front of that security guard who is by the door. And just at the moment that you are crossing the security guard, he sneezes. And you are in the line of fire because you just happen to be at the wrong place at the worst possible time. That is why you need to stay home unless you absolutely must be out there. Now that is what happens when you are dealing with the large droplets. The small droplets though, the droplet nuclei, because they are small, because they are light, they do not drop to the floor or drop to the surface quickly. They float around in the air for a long time. They float in the air for a long time. It means that even if you did not happen to pass in front of that security guard manning the door just as he has sneezed, and he is now saying, thank God no one was there when I sneezed, you happen to walk into the door a minute, 2 minutes, 3 minutes later possibly, and those micro droplets are still floating in the air while you are passing. So it means that they can still get onto your face, get into your eyes, into your nose, and into your mouth. So you recognize what is going on. That is for if somebody coughs or sneezes and the droplets are either directly in your way or they are floating, micro droplets still floating in the air for a significant amount of time after the person has coughed or sneezed. But there is another reason, and this is the part that's critical as it relates to people who are asymptomatic, meaning they do not have any symptoms of the virus or they have very mild symptoms. So they are not coughing, they are not sneezing, they are asymptomatic, but they have the virus inside of them. Have you ever been talking to somebody and they're killing you with spit? You know those people who, when they talk, you actually feel the local parlance boulders hitting you. So even if they are not talking, even if they are not sneezing, even if they are not coughing, the fact that they are talking means that the droplets and the micro droplets are still coming out of their mouths. And if they have COVID-19, then those micro droplets or those droplets have the virus inside of them. So you may be sitting casually chatting with your friend who is not showing any signs and symptoms, but because you all are sitting less than 6 feet apart from each other, just the average talking means that that virus is passing between you and the person. That is why we all need to stay home, to not be interacting even with people who we think are well, because that is still happening. Just think about it. I am sure I have been in, for example, in cars, driving in a car, where the driver is talking, or one person in the car is talking. And it doesn't matter where you are sitting in the car, whether it's right next to the person, in front and back, whatever, you could tell what that person ate because you are smelling their breath. You could tell that a smoker is a smoker, for example, because you are smelling the smoke on their breath. The fact that you are smelling what they ate and you are smelling the smoke on their breath, even if you are not right up close to them, is because the scent is coming out of their mouth through these droplets and micro droplets. That is why you need to not be mixing with people at this critical juncture, because we don't know who has it and who doesn't have it. And let me raise this point, because in Trinidad yesterday, the Minister of Health released 2 sets of maps. The maps included, there was one grouping of maps that showed the people who are confirmed cases of COVID-19 and where they live or where they are from. So you were seeing dots throughout the island of Trinidad and throughout the island of Tobago, right? Now, a second map was also shown for Trinidad, which includes the contact tracing information, meaning they know the cases in Trinidad. They've been able to say this person has been in contact with this person in San Fernando, with that person in Arima, with this, that kind of thing. You all recognize that no such map was presented for Tobago. You all recognize that. And that is because as hard as our CMOH's office and surveillance and all of those things are working, we seem to not have that information clearly outlined, clearly defined right now. You know what that means? Going back to the definitions that I gave earlier, we most likely have the community spread because we don't know exactly where some of these cases came from. Now, I get information all the time from all levels of people in society. All kind of people interact with me. And I get a lot of anecdotal information. I get a lot of confidential information that I will not release because I understand how critical this is. But some of the information that I have even gotten about who some of these cases are and the possible contacts with some of these cases and where they've been and who they've been in contact with made me shudder last night. Because I am now going back thinking, oh my God, I went to a funeral 2-3 weeks ago. Yes, I stayed by myself. Yes, I think. But I don't know. I may have been this close to someone. You went to a grocery and you saw somebody and they said hello last week or week before I went to the grocery. It was in the middle of the day, practically the grocery was empty, and a gentleman kept speaking to me and he kept coming close, and every time he stepped a foot forward, I stepped back 2 feet, and he got the impression that that means he needs to step forward 2 feet. So we were until I finally said, sir, I need you to step back. I don't know if he was in a place where the person who may or may not have it was last week or the week before. I don't know. And because I don't know, it means that I don't know whether I have come into contact with it or not. It means you, if you live on this island of Tobago, unless you are one of those people, and I joke about it, I know people who've actually been part of the 20,000 that have come into Trinidad and Tobago over the last couple weeks. And I know some of them who have been self-isolating. And I was jokingly telling one the other day, you may be one of the safest people because you have been keeping yourself to yourself. It is the rest of us who was going around and who keeps still going around as if life is normal. That is the problem. We don't know. And because we don't know, we have to start treating every single person, especially yourself, as if you have it. You may be asymptomatic, meaning you are not showing any signs of coughing, sneezing, or anything like that. But because you have not been in the presence of yourself and yourself only for the last month or so, you do not know. You may be one of those asymptomatic people walking around, talking normally to people and spreading the virus. So when the minister and all of those people are saying, you really need to stay home, you really need to stay home to yourself, and unless you are one of those people who absolutely must go out there, please stay home, please. And I am also sending this out to even people who are pretty close to me and people who are still liming normal. So yes, the Minister for Health and whoever else have decreased the number of people in a gathering from 25 in one instance down to 10 and now down to 5. And we are thinking, well, it's still down to 5, so we could still line with 5 friends. No, my dear. You cannot still line with your 5 friends. Unless you and your 5 friends have been in the presence of you and only your 5 friends for the last 2, 3, 4 weeks, you cannot still just line with your 5 friends or your 4 friends, because 4 plus 1 makes 5. You can't, because you don't know that the one friend who works in tea and tech, or the one friend who works in WhatsApp, or the one friend who is a medical professional who is working up at the hospital, where we currently have a case being warded at the hospital, who was on a ward mingling with everybody. All of the other health professionals were on the ward treating that patient like a normal patient because they had not confirmed that it was a COVID-19 patient. That nurse's aide, the person who brought the food, that person may be the husband or the wife of one of your 4 friends. And because that person is a husband or the wife of one of your 4 friends, you feel that you're just liming with your 4 friends. But no, you are liming with your 4 friends who lives in a house with somebody who was on a ward with somebody who is now confirmed to be a COVID-19 case. We cannot take that chance, Tobago. We are already in a situation where we do not know. And the reason they could not do that contact tracing map for Tobago is because we don't know. And because we don't know, we have to treat every single person as if they have it, including yourself, because you don't know. We cannot take this risk. I don't know if you all are not seeing the videos of people who are dying. There are trucks pulling up, ice trucks pulling up outside of hospitals in New York because they are dying. And the morgue does not have enough space for the people who are dying. And talking about dying, we in Tobago, Trinidad and Tobago, have had, 5 deaths so far of the 90-something. To be honest, our death rate is a little bit too high already compared to the number of people who have it. Our death rate, remember the world was saying that the death rate really is about 1.2%. We only have 90-something cases and already have 5 people dying. Our death rate in Trinidad and Tobago is already too high. So we have to be very, very conscious of that. Remember, this is the same health system that we were complaining about before COVID that did not, 6 deaths, thank you, that was not able to treat with our basic needs before COVID. Before COVID, our health system was not able to treat with our basic needs. So could you now imagine the health system that still isn't able to treat with our basic needs because we haven't really improved on the overall system, now has to deal with COVID-19. One other thing, we have the Minister of Health has announced that we have been testing a certain amount of people, and I should have written it down this morning, but we only have 90-something positives. The World Health Organization has said that unless we are getting a 10-to-1 ratio, meaning 10% of the people we test should be positive. If we are testing but having less or having more than that, it means we are not testing enough. In Trinidad and Tobago, we are not testing enough because our positive to the number of people who test ratio is about 15%. It means if we have 90-something people positive, we needed to test over 900 and something people, and we are not there yet. That has to do with the criteria that we've been using to test. And I am hoping that because we are following, Ministry of Health is following CARFA regulations, CARFA is following WHO. I am hoping that anytime now, the WHO is going to relax their rules about who we should test. Because the WHO is the one who said you only test people with symptoms So that already means if you don't have any signs and symptoms, you automatically will not get tested. And you had to have traveled or been in contact with a confirmed person. I don't want to be the bearer of bad news, but I am 100% sure that there are people in Trinidad and Tobago who either do not have signs and symptoms or have signs and symptoms but have not been in contact with a person who traveled who is confirmed and they are positive, and because of the rules we are using, we are not testing them. We need to ramp up testing. I heard the minister say recently, or I saw a news report say recently, that they are finally going to look into having a testing facility in Tobago. Thank God. Because we have been advocating for that from day one. They need to have a testing facility in Tobago, particularly now since they are expanding testing sites in Trinidad. There is no reason for us not to include Tobago in that expansion. So to all of the people who kept arguing with me, and I couldn't understand for the life of me why anyone would argue against testing in Tobago, as if Tobagonians stupid and we have no lab technicians who know anything about doing any tests, why we were arguing against testing in Tobago. But I'm happy that somebody's finally listening and they're finally recognizing that the situation in Tobago, though they may have some level of control of the situation in Trinidad, we do not really have that level of control in Tobago. And because of it, we need to do more testing in Tobago, and we may actually need to reduce or to have our testing protocol be less restrictive. Personally, I am suggesting that we test everyone with cold and flu-like symptoms. And if we really want to do it, we could pull some of the rapid testing results, that the rapid testing machines that have just gotten FDA approval in the US, so that we are not using our PCR, which is the expensive machines, the expensive tests, so we can do the rapid testing first. It's the same way how we do for HIV, for example. You go in, you do the little finger stick, they test you. If it's positive, they then take the blood and send it to a lab. We could do exactly the same thing for COVID-19. You do the rapid test, and the FDA just approved several rapid testing systems in the US. You do the rapid test. If it's positive, because it could be a false positive, and many of these machines are set up to give you false positives, you then send that blood or send that to be tested to using the PCR, which is the confirmation. That is the way it should happen, and we can't do that, and we need to be advocating for that here in Tobago. We absolutely need to be advocating for that. Now, the other thing that we need to be conscious of is, somebody asked in the live whether we are ready in Tobago. I don't know if you've been listening to the Ministry of Health's press conferences, and I don't know if you've been listening to the press conferences that have come out of Tobago, but the ones that have come out of Tobago have not been comforting, and they have not indicated that we are ready, or that we are even following the Ministry of Health's protocols for what we need to do in Tobago. And that is why the Minister for Health had to say, and it was a buff, I don't care what anybody else says. I don't care how anybody interprets it. The Prime Minister and the Minister for Health basically buffed publicly this week by saying they have to send their health officials in Trinidad to keep an eye on our health officials in Tobago, because from what they have been seeing and what they've been hearing, and if you look at that TV6 news report from April 1st on Tuesday, or was it Wednesday, you would recognize that we seem to not be following basic protocols even in our health system. We are not following basic protocols. And I would quickly highlight a couple things, because we are in a situation where, give me a second, we are in a situation where we have the benefit of hindsight. You know, they say hindsight is 20/20. We are in a situation where we have the benefit of hindsight for other countries. So we don't have to behave as if we are the first people and no one else is experiencing this. We have the benefit of other countries doing it wrong and now having to live with the consequences of doing it wrong. There's an article that came out, when did it come out? A couple days ago, the 25th of March, and it's in the HSJ online article. And the title of the article is Exclusive: The 3 Vital Lessons Italian Hospitals Have Learned in Fighting COVID-19. The 3 vital lessons Italian hospitals have learned in fighting COVID-19. And I don't know if you've been following, but the situation in Italy was dire. It is still horrible. Italy had some of the highest rates of infection, highest rates of death. As a matter of fact, they have, because they were so slow on the draw, they had surpassed China, supposedly, with the number of deaths and the number of cases. Well, the number of deaths. The US is quickly getting to that point because, again, the US is not following, they're not listening, and they're not following the guidelines of the people who know what they're talking about to show them